As a female, if you are facing thinning and losing hair, you are probably pretty stressed by it. However, you will not be worrying and causing more hair to drop once you understand some facts about female hair loss. You see, in many cases, female hair loss is just a temporary occurrence and hence, finding a hair loss solution to it is relatively easy. Androgenetic alopecia is the hereditary form of baldness that affects 50% of men, and some women after 40. Female hair loss usually starts after menopause, although it can begin earlier. The main reason for this is that estrogen levels decline. Hormonal changes cause hair to thin. It is comforting to note that other than androgenetic alopecia, the most common cause of hair loss in women is a result of metabolic and hormonal changes. Thus, the hair loss is usually temporary. Also, unlike men, women rarely become totally bald. However, what females generally experience is the thinning of their hair. For example, in the case of pregnancy, hair loss is temporary and should stop about 6 months after birth. When a woman is pregnant, a large amount of estrogen is produced, causing the hair follicles to go into their growth phase. Once the baby is born, the woman's hormonal balance is restored. The reverse now happens with the hair follicles going into a hair loss phase. While nothing much can be done to prevent hair loss during this period, applying hair tonic to hasten hair regrowth can be a helpful solution. Crash diets leading to rapid weight loss over a short period of time prompts excessive hair loss. Physical and emotional stress can cause hair loss, but this usually only occurs after a prolonged period of time and in extreme cases. Once stress levels are restored to normal levels, hair loss should stop. Thus, a good hair loss solution is to find ways to reduce stress. Certain drugs can also cause hair to shed. The most common medical treatment that causes hair loss is chemotherapy. The drug medication attacks the hair cells, causing hair loss from the scalp. Certain prescription drugs for thyroid hormone deficiency, diabetes, and lupus, and dieting supplements are also causes of hair loss. Once these drug medications are stopped, the hair loss problem should disappear. Other stresses to the hair may include frequent dyeing and chemicals, e.g. perming solutions applied to the hair. Generally, healthy hair can undergo these treatments without showing signs of stress, if they are not done too often. But if the hair is not allowed a chance to recover from the constant application of hair chemicals, then it becomes brittle and starts to break off. Hair loss treatment products to help strengthen the follicles should help when applied to the scalp. Once you understand what is happening to your hair, then seek out the right hair loss solution. In most cases, if the cause is temporary, then you can be assured that your problem will pass with the right remedy actions. However, for the more serious cases, do seek the professional help of a licensed dermatologist for a complete diagnosis and treatment plan.